Question 1. Compliance review shows that a manufacturing facility in Ontario has experienced a recent increase in musculoskeletal injuries, MSI, among assembly line workers. The occupational health professional OP has identified several ergonomic risk factors contributing to these injuries. Which of the following approaches best reflects the OHP's role in policy development to address this issue? Option A. The OHP should primarily focus on documenting each new MSI case and recommending individual treatment plans, waiting for management to initiate policy changes based on incident reports. Option B. The OHP should develop a comprehensive policy proposal outlining specific ergonomic interventions, revised work procedures, and a training program supported by scientific literature and presented to management for consideration and implementation. Option C. The OHP should inform the Human Resources Department of the rising MSI rates and defer all policy development and implementation decisions to them, as HR is responsible for workplace policies. Option D. The OHP should suggest minor adjustments to existing workstation layouts and provide general safety tips to workers, assuming that these small changes will be sufficient to mitigate the increased MSI rates. The correct answer is A. The OHP should primarily focus on documenting each new MSI case and recommending individual treatment plans, waiting for management to initiate policy changes based on incident reports. Explanation. This scenario presents a common challenge for occupational health professionals, OP, in Canada, navigating the complex landscape of policy development where their expertise is crucial, but their formal authority may be limited. The challenge lies in effectively translating scientific evidence and best practices into actionable policies that are both scientifically sound and practically implementable within an organization, while also adhering to relevant provincial and federal occupational health and safety legislation. Careful judgment is required to balance the ideal with the feasible, ensuring that policies protect worker health and safety without creating undue burdens or being easily circumvented. The correct approach emphasizes the OHP's role as a subject matter expert and advocate for worker well-being, leveraging their knowledge to inform and influence policy. This involves proactive engagement, evidence-based recommendations, and collaborative efforts with management and other stakeholders. This approach aligns with the ethical obligations of OHPs to promote health and safety and their professional responsibility to contribute to a safe work environment, as implicitly supported by the general principles of occupational health and safety legislation across Canadian jurisdictions, which mandate employers to provide a safe workplace and often require consultation with health and safety representatives or committees. Incorrect approaches fail to recognize the OHP's full potential or misinterpret their role. One incorrect approach, focusing solely on reactive responses to incidents, neglects the preventative and proactive nature of occupational health, which is a cornerstone of effective policy development. This failure to engage in policy creation before issues arise is a significant ethical and professional lapse, as it means opportunities to prevent harm are missed. Another incorrect approach, which prioritizes administrative convenience over scientific evidence, risks developing policies that are ineffective, unenforceable, or even detrimental to worker health. This directly contravenes the OHP's duty to base recommendations on sound scientific principles and best practices, and could lead to noncompliance with legislative requirements for hazard identification and control. A third incorrect approach, which delegates policy development entirely to non-OHP personnel without adequate OHP input, abdicates the OHP's responsibility to ensure that policies are medically and scientifically appropriate, potentially leading to policies that are inadequate or create new risks. This is a failure to uphold professional standards and a potential breach of the duty of care. The professional reasoning process should involve 1. Identifying the need for policy development or review based on risk assessments, incident data, or emerging health concerns. 2. Gathering and critically evaluating relevant scientific evidence, epidemiological data, and best practice guidelines. 3. Collaborating with management, workers, and other relevant stakeholders to understand organizational context and feasibility. 4. Developing evidence-based policy recommendations that are clear, actionable, and legally compliant. 5. Advocating for the adoption of these policies through clear communication and demonstration of their benefits. 6. participating in ongoing policy review and evaluation to ensure continued effectiveness. Question 2. Cost-benefit analysis shows that implementing a streamlined, partially automated system for occupational health record keeping could reduce administrative overhead. However, the physician must ensure that this system adheres strictly to the reporting and record-keeping requirements mandated by Canadian occupational health and safety legislation and the College of Physicians and Surgeons of relevant province/territory. Considering these regulatory imperatives, which of the following approaches best balances efficiency with professional and legal obligations? Option A. The physician personally documents all clinical findings, assessments, and recommendations directly into the electronic health record, utilizing predefined templates for common occupational health conditions to enhance efficiency, with administrative staff handling only the scheduling and billing components. Option B. The physician instructs administrative staff to summarize key findings from patient encounters based on their own observations and brief physician verbal cues, and then to enter these summaries into the patient's record. Option C. The physician delegates the initial documentation of all patient findings and recommendations to a trained administrative assistant, who then enters this information into the electronic health record for the physician's final review and signature. Option D. The physician relies on dictation software to record all patient encounters, with the transcribed notes being automatically filed into the patient's record without a subsequent physician review to save time. The correct answer is C. The physician delegates the initial documentation of all patient findings and recommendations to a trained administrative assistant, who then enters this information into the electronic health record for the physician's final review and signature. Explanation. This scenario presents a professional challenge due to the inherent tension between efficient data management and the stringent legal and ethical obligations surrounding occupational health records in Canada. The physician must balance the need for timely access to information for patient care and potential regulatory reporting with the imperative to maintain the accuracy, completeness, and confidentiality of these records as mandated by provincial/territorial occupational health and safety legislation and professional college guidelines. The physician's judgment is critical in determining the appropriate level of detail and the method of record keeping to ensure compliance and protect patient interests. The correct approach represents best professional practice because it prioritizes the physician's direct involvement in the creation and maintenance of occupational health records. This ensures that the records accurately reflect the physician's clinical assessment and professional opinion, which is a cornerstone of responsible medical practice and a requirement for compliance with reporting obligations. By personally documenting findings and recommendations, the physician upholds the integrity of the record, facilitates accurate reporting to relevant authorities e.g., WCB, Ministry of Labor, when required, and provides a reliable basis for future medical management and legal defense. This direct oversight minimizes the risk of misinterpretation or omission of critical information, thereby safeguarding both the patient's health and the physician's professional standing. An incorrect approach that relies solely on administrative staff to transcribe or summarize physician notes without direct physician review and approval fails to meet the standard of professional record keeping. This can lead to inaccuracies, omissions, or misinterpretations of clinical findings, which are critical in occupational health. Such a practice risks violating the duty of care owed to the patient and can result in non-compliance with reporting requirements, potentially leading to regulatory penalties or legal challenges. Furthermore, it undermines the physician's accountability for the content of the medical record. Another incorrect approach that involves delegating the entire record-keeping process, including the initial documentation of findings and recommendations, to non-medical personnel without physician oversight is ethically and legally unsound. Occupational health records contain sensitive medical information and require professional medical judgment for accurate interpretation and documentation. This delegation bypasses the physician's core responsibility for patient assessment and record integrity, creating a significant risk of errors that could have serious consequences for the worker's health and safety, as well as for the employer's compliance obligations. A third incorrect approach that focuses on minimizing the detail in records to reduce administrative burden, without considering the potential need for comprehensive documentation for future reporting or legal purposes, is also professionally unacceptable. While efficiency is desirable, It must not compromise the completeness and accuracy required by occupational health legislation and professional standards. Inadequate records can hinder proper follow-up care, impede accurate reporting to regulatory bodies, and leave the physician vulnerable if the record is later scrutinized in a legal or regulatory context. The professional decision-making process for similar situations should involve a thorough understanding of the relevant provincial/territorial occupational health and safety legislation, professional college guidelines for medical record keeping, and the specific reporting requirements of agencies like the Workplace Safety and Insurance Board, WSIB, or equivalent. Physicians should always prioritize the accuracy, completeness, and confidentiality of patient records. When delegating tasks, clear protocols must be established, ensuring that all medical information is reviewed, validated, and approved by the physician before being finalized in the patient's record. The physician must retain ultimate responsibility for the integrity of the occupational health record. Question 3. Stakeholder feedback indicates a need for clearer understanding regarding the distinct role of occupational medicine practitioners within the Canadian healthcare landscape. Considering the definition and scope of occupational medicine, which of the following best delineates its primary focus and responsibilities? Option A. The provision of medical advice to employers on all aspects of employee well-being, including personal financial matters. Option B. The prevention, diagnosis, and management of work-related injuries and illnesses, and the promotion of health and productivity in the workplace. Option C. The provision of general medical care to all employees, regardless of the nature of their health concerns. Option D. The management of chronic diseases in the general population, with a secondary consideration for their impact on work. Correct answer is B. The prevention, diagnosis, and management of work-related injuries and illnesses, and the promotion of health and productivity in the workplace. Explanation. This scenario presents a professional challenge due to the inherent complexity in defining the precise boundaries of occupational medicine within the Canadian healthcare system, particularly when considering the interplay between provincial/territorial legislation and federal oversight. Occupational physicians must navigate these jurisdictional nuances to ensure they are practicing within their defined scope and adhering to all relevant regulations. Careful judgment is required to distinguish between general medical practice and specialized occupational health services. The correct approach represents best professional practice because it aligns with the core principles of occupational medicine as defined by the Canadian Board of Occupational Medicine, CBOM, and relevant provincial/territorial regulatory colleges. Occupational medicine, by definition, focuses on the prevention, diagnosis, and management of work-related injuries and illnesses, as well as the promotion of health and productivity in the workplace. This involves understanding the relationship between work environments, exposures, and health outcomes, which extends beyond the scope of general medical practice. Adherence to this definition ensures that practitioners are providing specialized care that meets the unique needs of workers and employers, and that they are operating within the ethical and legal frameworks governing their practice. An incorrect approach that focuses solely on treating acute work-related injuries without considering the broader context of workplace hazards, prevention strategies, or long-term health impacts fails to encompass the full scope of occupational medicine. This is a regulatory and ethical failure because it neglects the preventative and proactive aspects of the discipline, which are central to its purpose. Another incorrect approach that involves providing general medical advice to employers on non-occupational health matters, or engaging in practice that falls outside the established competencies of occupational medicine as recognized by the CBOM, represents a significant ethical and regulatory breach. This could lead to misdiagnosis, inappropriate treatment, and potential harm to workers, as well as a violation of professional standards and scope of practice regulations. The professional decision-making process for similar situations should involve a clear understanding of the definition and scope of occupational medicine as outlined by the CBOM. Professionals must critically assess whether a given situation falls within their specialized expertise and regulatory purview. This requires ongoing professional development, consultation with colleagues and regulatory bodies when in doubt, and a commitment to practicing within the defined boundaries of occupational medicine to ensure the highest standard of care and ethical conduct. Question 4. The monitoring system demonstrates a pattern of elevated physiological responses in a subset of workers exposed to a specific chemical agent. The system captures detailed individual data, including heart rate variability and specific biomarkers. The occupational physician is tasked with reporting findings to the employer to inform workplace safety measures, but is unsure of the extent to which individual-level data can be shared under the relevant provincial occupational health and safety legislation. Option A. Report aggregated and anonymized data to the employer, focusing on trends and the need for further investigation or control measures related to the chemical agent, while retaining detailed individual records for clinical follow-up as per privacy legislation. Option B. Share the detailed individual data, including names and specific biomarker results, with the employer to allow for immediate targeted interventions for affected employees. Option C. Advise the employer that no data can be shared due to privacy concerns, and recommend a complete overhaul of the monitoring system to eliminate individual-level data capture. Option D. Provide the employer with a summary of the chemical agent's known health effects and general recommendations for exposure reduction, without referencing any data from the monitoring system. Correct answer is A. Report aggregated and anonymized data to the employer, focusing on trends and the need for further investigation or control measures related to the chemical agent, while retaining detailed individual records for clinical follow-up as per privacy legislation. Explanation. Scenario analysis. This scenario presents a common challenge in occupational medicine, balancing the need for comprehensive health surveillance with the privacy rights of employees and the specific reporting requirements of provincial/territorial legislation. The challenge lies in interpreting and applying these regulations accurately, especially when data collection methods might inadvertently capture information beyond the immediate scope of occupational health monitoring. A failure to adhere to these regulations can lead to significant legal repercussions, damage to the employer-employee relationship, and erosion of trust in the occupational health program. Correct approach analysis. The correct approach involves a meticulous review of the specific provincial or territorial occupational health and safety legislation governing the workplace. This legislation will define what health information is permissible to collect, the purpose for which it can be collected, how it must be stored, and to whom it can be disclosed. Best professional practice dictates that the occupational physician must ensure that any monitoring system, including its data output, strictly adheres to these legal parameters. This means that data collected should be relevant to identified occupational hazards, and that any reporting to the employer or regulatory bodies is anonymized or aggregated to protect individual employee privacy, unless specific consent or legal obligation dictates otherwise. The physician's role is to act as a gatekeeper, ensuring that the data serves its intended occupational health purpose, without overstepping legal boundaries. Incorrect approach is analysis. One incorrect approach is to assume that all data generated by a monitoring system is automatically permissible for employer review. This fails to acknowledge the privacy rights of employees and the specific limitations imposed by provincial/territorial laws. Such an approach could lead to unauthorized disclosure of sensitive health information, violating privacy legislation, and potentially leading to legal action against the employer and the physician. Another incorrect approach is to disregard the monitoring system's output entirely due to privacy concerns, without first attempting to reconcile it with legal requirements. This can hinder the effective identification and management of occupational health risks, as valuable data might be ignored. It also fails to fulfill the physician's professional obligation to protect worker health through appropriate surveillance. A third incorrect approach is to rely on general best practices for health data management without consulting the specific provincial or territorial regulations. While general principles are important, they are not a substitute for legally mandated requirements. Provincial and territorial laws often have unique provisions regarding occupational health surveillance that must be followed precisely. Professional reasoning. Professionals in occupational medicine must adopt a proactive and legally informed approach. This involves 1. Understanding the specific provincial/territorial legislative framework applicable to their practice. 2. Evaluating any health monitoring system against these legal requirements, focusing on data relevance, purpose of collection and disclosure protocols. 3. implementing data management practices that prioritize employee privacy while enabling effective occupational health surveillance. 4. Seeking legal counsel or consulting with regulatory bodies when there is ambiguity regarding compliance. 5. Maintaining clear communication with employers regarding the scope and limitations of occupational health data reporting. Question 5. Strategic planning requires an occupational physician to assess a situation where an employee reports experiencing new, intermittent symptoms that they believe are work-related and are impacting their ability to perform certain tasks. The employer is concerned about potential productivity losses and the need for immediate operational adjustments. What is the most appropriate course of action for the occupational physician to ensure compliance with Canadian occupational health and safety regulatory frameworks and ethical best practices? Option A. Prioritize the employer's concerns about operational efficiency and productivity by suggesting the employee continue working as usual while monitoring the situation, deferring detailed medical investigation until symptoms significantly worsen. Option B. Advise the employer to immediately reassign the employee to a less demanding role to prevent any potential further impact on productivity, without a comprehensive medical assessment of the employee's condition or its specific work-relatedness. Option C. Conduct a thorough medical evaluation of the employee, gather objective data regarding the symptoms and their potential work-relatedness, and collaborate with both the employee and employer to develop a medically appropriate plan for assessment, potential accommodation, and safe return to duties, adhering to all relevant provincial/territorial legislation. Option D. Recommend that the employee take an indefinite leave of absence until they can definitively prove their symptoms are work-related, placing the burden of proof entirely on the employee. The correct answer is C. Conduct a thorough medical evaluation of the employee, gather objective data regarding the symptoms and their potential work-relatedness, and collaborate with both the employee and employer to develop a medically appropriate plan for assessment, potential accommodation, and safe return to duties, adhering to all relevant provincial/territorial legislation. Explanation. This scenario presents a common challenge in occupational medicine, where a physician's clinical judgment and ethical obligations intersect with the employer's operational needs and potential pressures. The professional challenge lies in balancing the duty of care to the employee with the employer's right to a safe and productive workplace, while adhering strictly to the regulatory framework governing occupational health and safety in Canada. Specifically, as it pertains to the CBOM certification, the physician must navigate potential conflicts of interest and ensure that any recommendations are evidence-based, medically sound, and compliant with relevant provincial/territorial occupational health and safety legislation and any applicable federal regulations. The correct approach emphasizes a systematic, evidence-based, and collaborative process. It prioritizes the employee's health and safety by recommending appropriate medical evaluations and accommodations based on objective findings. This aligns with the ethical principles of beneficence and non-maleficence, ensuring the employee receives necessary medical attention and is not unduly exposed to further harm. Furthermore, it upholds the regulatory requirement for employers to provide a safe working environment and to accommodate employees with medical conditions to the point of undue hardship, as mandated by occupational health and safety legislation. This approach also fosters a transparent and constructive relationship between the physician, employee, and employer, which is crucial for effective compliance and long-term health management. Incorrect approaches fail to meet these standards. Recommending immediate removal from duties without a thorough medical assessment or sufficient objective evidence of risk is premature and potentially harmful to the employee's livelihood and well-being. It bypasses the due diligence required by occupational health and safety regulations, which typically mandate a process of assessment, consultation, and accommodation. Similarly, deferring solely to the employer's operational concerns without adequate medical justification or consideration for the employee's health constitutes a breach of the physician's primary duty of care and a failure to comply with regulatory obligations to protect worker health. Ignoring the employee's input or concerns also undermines the collaborative nature of effective occupational health management and can lead to grievances or legal challenges. The professional decision-making process in such situations should involve 1. Gathering comprehensive medical information about the employee's condition and its potential impact on their work. 2. objectively assessing the risks associated with the employee's specific job duties and the work environment. 3. Consulting with the employee to understand their perspective, limitations, and any proposed accommodations. 4. Collaborating with the employer to explore feasible accommodations that mitigate risks and allow the employee to perform their duties safely. 5. Documenting all assessments, recommendations, and communications thoroughly. 6. Adhering strictly to the relevant provincial/territorial occupational health and safety legislation and any applicable federal guidelines. Question 6. The assessment process reveals a worker reporting symptoms they attribute to recent, albeit unquantified, exposure to a radioactive source used in their industrial radiography work. The worker expresses anxiety about potential long-term health effects. What is the most appropriate initial approach for the occupational physician to take? Option A. Recommend that the worker cease all work involving radioactive materials immediately and await further guidance from regulatory bodies, without first assessing the actual exposure risk. Option B. Immediately initiate a detailed investigation into the specific type of radioactive source, the worker's documented exposure levels, if available, the employer's radiation safety protocols, and relevant provincial/territorial radiation safety regulations to determine the extent of exposure and potential health risks. Option C. Focus on managing the worker's reported symptoms with symptomatic treatment and reassure them that modern industrial radiography is generally safe, without delving into specific exposure details unless symptoms worsen significantly. Option D. Advise the worker to seek a second opinion from a radiologist, as the occupational physician's expertise may be limited in interpreting radiation-related health concerns. Correct answer is B. Immediately initiate a detailed investigation into the specific type of radioactive source, the worker's documented exposure levels, if available, the employer's radiation safety protocols, and relevant provincial/territorial radiation safety regulations to determine the extent of exposure and potential health risks. Explanation. The assessment process reveals a complex situation involving potential radiation exposure in a workplace. This scenario is professionally challenging because occupational physicians must balance the immediate need to protect worker health with the complexities of radiation safety regulations, the interpretation of exposure data, and the potential for long-term health consequences. Careful judgment is required to ensure compliance with Canadian occupational health and safety legislation, specifically as it pertains to ionizing radiation, and to provide appropriate medical guidance. The correct approach represents best professional practice because it prioritizes a thorough, evidence-based assessment of the worker's exposure and health status, directly aligning with the principles of occupational medicine and the regulatory framework governing radiation safety in Canada. This involves consulting relevant provincial/territorial radiation safety regulations, which mandate specific monitoring, reporting, and medical surveillance requirements for workers exposed to ionizing radiation. It also emphasizes the physician's ethical duty to advocate for the worker's well-being and to ensure that all actions are taken in accordance with established scientific and regulatory standards. An incorrect approach that focuses solely on immediate symptom management without investigating the radiation exposure source or levels fails to meet regulatory obligations. Canadian regulations require employers to control radiation exposure and to ensure workers are informed of risks and protected. A physician who neglects to investigate the source and extent of potential exposure is failing in their duty to identify and mitigate occupational hazards, potentially leading to continued or increased exposure and adverse health outcomes. This also constitutes an ethical failure to conduct a comprehensive occupational health assessment. Another incorrect approach that relies on anecdotal information or general knowledge about radiation without consulting specific workplace exposure data or regulatory guidelines is also professionally unacceptable. Occupational physicians are expected to base their assessments and recommendations on objective data and established protocols. Failure to do so can result in misdiagnosis, inappropriate treatment, and a lack of necessary protective measures, violating both regulatory requirements for accurate record-keeping and worker protection, and the ethical standard of providing competent medical care. A further incorrect approach that dismisses the worker's concerns without a proper investigation into potential radiation exposure is ethically and regulatorily unsound. All worker complaints and concerns regarding potential occupational hazards must be taken seriously and investigated thoroughly. Ignoring such concerns can lead to a breakdown of trust, a failure to identify significant health risks, and potential legal repercussions for both the physician and the employer, as it contravenes the principles of due diligence and worker safety enshrined in Canadian legislation. The professional decision-making process for similar situations should involve a systematic approach. 1. Acknowledge and validate the worker's concerns. 2. Gather comprehensive information about the potential exposure, including the type of radiation, duration, frequency, and any available monitoring data. 3. Consult relevant provincial/territorial occupational health and safety legislation and radiation safety regulations. 4. If necessary, liaise with the employer's safety officer or radiation safety officer to obtain detailed exposure records and information about control measures. 5. Conduct a thorough medical assessment, considering both immediate symptoms and potential long-term effects of radiation exposure. 6. Formulate a management plan that includes appropriate medical follow-up, recommendations for exposure reduction, and reporting as required by regulations. 7. Document all findings, assessments, and recommendations meticulously. Question 7. Operational review demonstrates the presence of a significant physical hazard in a manufacturing facility, specifically high levels of noise exceeding recommended exposure limits, but no workers have reported any hearing-related symptoms or illnesses. The occupational physician is consulted to advise on the appropriate course of action. Option A. Initiate a comprehensive noise reduction program, including engineering controls and administrative measures, and implement a hearing conservation program with regular audiometric testing for all potentially exposed workers. Option B. Recommend that all workers exposed to the noise hazard immediately cease work in that area until the noise levels can be reduced. Option C. Suggest that workers be provided with personal hearing protection devices and instructed on their proper use, with no further immediate action required. Option D. Advise the employer to monitor the situation and take action only if workers begin to report hearing loss or other related symptoms. The correct answer is A. Initiate a comprehensive noise reduction program, including engineering controls and administrative measures, and implement a hearing conservation program with regular audiometric testing for all potentially exposed workers. Explanation. Scenario analysis. This scenario presents a common challenge in occupational medicine where a physical hazard is identified, but its immediate impact on worker health is not definitively established. The professional challenge lies in balancing the need for proactive risk management with the practicalities of resource allocation and the urgency of intervention. A physician must interpret potentially incomplete data, consider the spectrum of potential health effects, and make a judgment call that protects worker well-being without causing undue alarm or disruption. The absence of immediate, overt symptoms does not negate the potential for long-term or insidious harm, requiring a nuanced approach. Correct approach analysis. The most appropriate approach involves a comprehensive risk assessment and the implementation of control measures based on the hierarchy of controls, prioritizing elimination and substitution. This aligns with the principles of the Canada Labour Code and provincial occupational health and safety legislation, which mandate employers to provide a safe and healthy workplace. Specifically, the employer has a duty to identify hazards, assess risks, and implement measures to control them. In this case, even without confirmed cases of illness, the presence of a recognized physical hazard necessitates proactive management. This approach reflects best professional practice by prioritizing prevention, adhering to regulatory obligations to protect workers, and employing a systematic, evidence-informed strategy to mitigate potential harm. Incorrect approaches analysis. One incorrect approach would be to take no immediate action, citing the lack of reported health issues. This fails to meet the employer's duty of care under Canadian occupational health and safety legislation, which requires proactive hazard identification and control, not just reactive responses to illness. It also ignores the potential for latent health effects from physical hazards, which may not manifest for years. Another incorrect approach would be to immediately implement the most stringent and costly control measures without a thorough risk assessment. While well-intentioned, this may be an inefficient use of resources and could lead to unnecessary disruption. Best practice dictates a tiered approach to control, starting with less intrusive measures where appropriate, based on the assessed risk level. This approach might also be seen as overly alarmist without sufficient evidence to justify such drastic action. A third incorrect approach would be to solely rely on personal protective equipment, PPE, as the primary control measure. While PPE is a component of hazard control, it is generally considered the least effective and should be used in conjunction with, or as a last resort after, higher-level controls like elimination, substitution, engineering controls, and administrative controls. Over-reliance on PPE can create a false sense of security and does not address the root cause of the hazard. Professional reasoning. Professionals should utilize a decision-making framework that begins with hazard identification and risk assessment. This involves understanding the nature of the physical hazard, the potential exposure pathways, the duration and intensity of exposure, and the susceptibility of the exposed population. Following this, the hierarchy of controls should be applied systematically. This framework ensures that interventions are proportionate to the risk, evidence-based, and aligned with legal and ethical obligations to protect worker health and safety. Question 8. Governance review demonstrates that a manufacturing facility is introducing a new chemical solvent with known respiratory and dermal irritant properties. The company needs to establish a health surveillance program for employees working with this solvent. Considering the principles of occupational health and safety in Canada, which of the following approaches would be most appropriate for health surveillance? Option A. Program combining biological monitoring for solvent absorption and periodic medical examinations focused on respiratory and dermal health. Option B. A program relying solely on general health questionnaires administered annually to all employees. Option C. A program that exclusively uses worker self-reporting of any symptoms experienced. Option D. A program consisting only of annual general medical examinations for all staff. The correct answer is A. A program combining biological monitoring for solvent absorption and periodic medical examinations focused on respiratory and dermal health. Explanation. Scenario analysis. This scenario presents a common challenge in occupational medicine, where a company is implementing a new process with potential health risks. The challenge lies in selecting the most appropriate health surveillance methods to effectively monitor worker health without being overly burdensome or ineffective. Balancing the need for early detection of adverse health effects with resource allocation and employee privacy is paramount. The governance review highlights the need for a proactive and evidence-based approach to occupational health management. Correct approach analysis. Implementing a multifaceted health surveillance program that combines biological monitoring and periodic medical examinations, tailored to the specific hazards identified, e.g., respiratory irritants, dermal sensitizers, represents best professional practice. This approach aligns with the principles of occupational health and safety legislation in Canada, which emphasizes the employer's duty to protect worker health. The Canadian Centre for Occupational Health and Safety, CCO's, guidelines and provincial occupational health and safety acts mandate proactive measures to identify and control workplace hazards. Biological monitoring provides objective data on exposure levels, while medical examinations can detect early signs of health impairment. This combination offers a comprehensive and sensitive approach to surveillance, allowing for timely intervention and prevention of long-term health consequences. Incorrect approaches analysis. Focusing solely on general health questionnaires without specific exposure-related questions or objective measures fails to adequately address the identified risks. This approach is insufficient as it relies on subjective reporting and may miss subtle or asymptomatic health effects directly attributable to the new process. It falls short of the proactive duty of care required by Canadian occupational health and safety legislation. Implementing only annual general medical examinations without considering the specific hazards of the new process is also inadequate. These examinations may not be sensitive enough to detect early occupational health issues related to the new materials or processes, leading to delayed diagnosis and intervention. This approach lacks the targeted nature necessary for effective occupational health surveillance. Relying exclusively on worker self-reporting of symptoms without any objective monitoring or medical assessment is a significant regulatory and ethical failure. This method is highly subjective and prone to underreporting or misinterpretation of symptoms. It does not fulfill the employer's obligation to actively monitor and protect worker health, as mandated by Canadian occupational health and safety laws. Professional reasoning. Professionals should approach health surveillance by first conducting a thorough risk assessment of the new process, identifying specific hazards and potential health outcomes. This assessment should inform the selection of appropriate surveillance methods, prioritizing those that are evidence-based, sensitive, and specific to the identified risks. Consultation with workers and their representatives, as well as adherence to relevant provincial and federal occupational health and safety regulations and guidelines from bodies like CBOM, are crucial steps in developing and implementing an effective and ethically sound health surveillance program. Question 9. Assessment of a newly identified airborne particulate in a manufacturing facility requires a structured approach to protect worker health. Which of the following strategies best aligns with the principles of health promotion and disease prevention in the workplace, considering the need for a comprehensive risk management process? Option A. Immediately mandate the use of high-level personal protective equipment for all tasks involving the new particulate, without further investigation into exposure levels or alternative controls. Option B. Implement a program of regular respiratory health surveillance for all exposed workers, coupled with mandatory annual health questionnaires regarding respiratory symptoms. Option C. Conduct a thorough risk assessment to quantify exposure levels, evaluate potential health impacts, and implement controls based on the hierarchy of controls, prioritizing elimination or engineering solutions. Option D. Provide workers with general information on maintaining good respiratory health through lifestyle choices, such as avoiding smoking and eating a balanced diet. Correct answer is B. Implement a program of regular respiratory health surveillance for all exposed workers, coupled with mandatory annual health questionnaires regarding respiratory symptoms. Explanation. Scenario analysis. This scenario presents a common challenge in occupational medicine, where a new hazard is identified, requiring a proactive and systematic approach to protect worker health. The challenge lies in moving beyond simply acknowledging the risk to implementing effective, evidence-based prevention strategies that are integrated into the workplace's health and safety management system. The occupational physician must balance the immediate need for intervention with the long-term goal of sustainable health promotion. Correct approach analysis. The correct approach involves a comprehensive risk assessment that moves from hazard identification to evaluating exposure levels, understanding the potential health effects, and then developing targeted control measures. This aligns with the principles of occupational health and safety legislation in Canada, which mandates employers to identify and control workplace hazards. Specifically, this approach reflects the hierarchy of controls, prioritizing elimination or substitution, followed by engineering controls, administrative controls, and finally, personal protective equipment. This systematic process ensures that interventions are proportionate to the risk and are implemented in a way that minimizes disruption while maximizing worker protection. It also supports the ethical obligation of the occupational physician to advocate for the health and safety of the workforce. Incorrect approaches analysis. One incorrect approach would be to solely rely on providing personal protective equipment, PPE, without a thorough assessment of exposure or consideration of higher-level controls. This fails to address the root cause of the hazard and places the burden of protection entirely on the individual worker, which is often less effective and unsustainable. Ethically, it may be seen as a failure to adequately protect workers if less intrusive and more effective controls are feasible. Legally, it may not meet the employer's duty to provide a safe and healthy workplace if other control measures could have been implemented. Another incorrect approach would be to recommend general health education on respiratory health without specific linkage to the identified workplace hazard. While health education is valuable, it lacks the specificity required for targeted disease prevention related to a particular exposure. This approach fails to meet the regulatory requirement to control identified workplace hazards and may not be considered best professional practice as it does not directly mitigate the identified risk. A third incorrect approach would be to wait for workers to report symptoms before initiating any preventative measures. This reactive approach is contrary to the principles of occupational health and safety, which emphasize proactive hazard identification and control. Waiting for symptoms to appear means that workers have already been exposed and potentially harmed, representing a failure in disease prevention and a potential breach of regulatory obligations to prevent workplace injuries and illnesses. Professional reasoning. Professionals should approach this situation by first understanding the employer's legal obligations under relevant provincial or territorial occupational health and safety legislation. This involves a systematic risk assessment process, identifying the hazard, assessing the level and duration of worker exposure, understanding the potential health consequences, and then implementing controls based on the hierarchy of controls. This process should be documented and communicated to both management and workers. The occupational physician's role is to provide expert advice on the health risks and recommend appropriate control strategies, ensuring that the chosen interventions are effective, practical, and aligned with regulatory requirements and ethical standards. Question 10. Comparative studies suggest that when advising a company on managing potential infectious agent exposures for workers involved in excavation, which approach best aligns with Canadian occupational health and safety principles and best practices for infectious disease prevention in the workplace. Option A. Focusing exclusively on worker education regarding hygiene practices, assuming this will adequately mitigate the risks of infectious agent exposure. Option B. Relying solely on post-exposure medical treatment and follow-up for any worker who reports symptoms after potential contact with soil. Option C. Implementing a comprehensive risk assessment that prioritizes engineering and administrative controls, followed by appropriate personal protective equipment and robust post-exposure protocols. Option D. Recommending vaccination for all possible soil-borne pathogens, without a specific risk assessment of the excavation site. The correct answer is C. Implementing a comprehensive risk assessment that prioritizes engineering and administrative controls, followed by appropriate personal protective equipment and robust post-exposure protocols. Explanation. Scenario analysis. A physician is tasked with advising a construction company on managing potential infectious agent exposures in workers who may encounter soil-borne pathogens during excavation. This scenario is professionally challenging because it requires balancing worker safety with operational demands, understanding the nuances of occupational exposure to infectious agents, and applying Canadian regulatory frameworks to a specific workplace context. The physician must consider the likelihood of exposure, the severity of potential illness, and the feasibility of control measures, all while adhering to provincial occupational health and safety legislation and public health guidelines. Correct approach analysis. The correct approach involves a comprehensive risk assessment that prioritizes primary prevention through engineering and administrative controls, followed by appropriate personal protective equipment, PPE, and robust post-exposure protocols. This aligns with the hierarchy of controls mandated by Canadian occupational health and safety legislation, which emphasizes eliminating or minimizing hazards at the source. Specifically, this approach would involve identifying potential soil-borne pathogens relevant to the excavation site, e.g., tetanus, certain parasitic infections, assessing the routes of transmission, e.g., percutaneous injury, inhalation of dust, ingestion, and implementing measures such as dust suppression, proper waste disposal, and worker education on hygiene. The use of appropriate PPE, such as gloves and respiratory protection where indicated, and ensuring access to timely medical evaluation and treatment following potential exposure, are critical components of this best practice. This approach is ethically sound, prioritizing the well-being of workers and fulfilling the physician's duty of care under relevant provincial statutes. Incorrect approach is analysis. Relying solely on post-exposure treatment without implementing preventative measures fails to address the root cause of the hazard and violates the principles of occupational health and safety legislation, which mandate proactive risk management. This approach is ethically problematic as it places a greater burden on the worker to manage the consequences of exposure rather than preventing it. Recommending vaccination for all possible pathogens without a specific risk assessment is inefficient and may not be practical or cost-effective. While vaccination is a valuable control measure, its application should be guided by the identified risks and the availability of effective vaccines for specific agents and exposure scenarios. This approach could lead to unnecessary medical interventions and resource allocation. Focusing exclusively on worker education without implementing engineering or administrative controls is insufficient. While education is important for promoting safe practices, it is the least effective control measure when used in isolation, as it relies heavily on individual compliance and does not inherently reduce the hazard itself. This approach neglects the employer's responsibility to provide a safe work environment as stipulated by occupational health and safety laws. Professional reasoning. Professionals should adopt a systematic, evidence-based approach to occupational health risk management. This involves 1. Hazard identification, identifying potential infectious agents and exposure pathways relevant to the specific work environment. 2. Risk assessment, evaluating the likelihood and severity of harm from identified hazards. 3. Control measure implementation, applying the hierarchy of controls, prioritizing elimination, substitution, engineering controls, administrative controls, and finally, PPE. 4. Monitoring and review, regularly assessing the effectiveness of control measures and updating protocols as needed. 5. Communication and education, ensuring workers are informed about risks and control measures. This structured process ensures compliance with regulatory requirements and upholds ethical obligations to protect worker health. Question 11. The assessment process reveals a worker reporting intermittent headaches, fatigue, and mild nausea. The worker has a history of working with various solvents in a manufacturing setting, but also reports significant stress at home and a recent viral illness. The occupational physician needs to determine the most appropriate initial step in evaluating the worker's symptoms. Option A. Immediately advise the worker that their symptoms are likely due to stress and the recent viral illness, and no further workplace investigation is necessary. Option B. Focus solely on the worker's home environment and personal lifestyle factors to identify the cause of their symptoms. Option C. Recommend a broad range of nonspecific laboratory tests without a clear hypothesis regarding the cause of the symptoms. Option D. Initiate a detailed toxicological assessment focusing on potential solvent exposure, including a review of safety data sheets, SDS. For the solvents used, a detailed exposure history questionnaire, and consideration of biological monitoring if indicated. The correct answer is D. Initiate a detailed toxicological assessment focusing on potential solvent exposure, including a review of safety data sheets, SDS. For the solvents used, a detailed exposure history questionnaire, and consideration of biological monitoring if indicated. Explanation. Scenario analysis. This scenario presents a common challenge in occupational medicine, where a worker reports symptoms that could be related to workplace exposures, but also have non-occupational causes. The professional challenge lies in differentiating between these potential causes, ensuring accurate diagnosis, and implementing appropriate management strategies without causing undue alarm or missing a critical occupational health issue. This requires a systematic approach grounded in the principles of toxicology and a thorough understanding of the worker's exposure history and medical condition. Correct approach analysis. The correct approach involves a comprehensive toxicological assessment. This includes a detailed occupational and environmental history to identify potential exposures, a thorough medical history and physical examination to evaluate symptoms, and consideration of relevant diagnostic tests. This approach aligns with the fundamental principles of occupational medicine, emphasizing the importance of identifying the source of harm and protecting worker health. It adheres to the ethical obligation to provide evidence-based care and to investigate potential workplace hazards. The Canadian Board of Occupational Medicine, CBOM, certification emphasizes a holistic approach to occupational health, which necessitates exploring all plausible etiologies for a patient's condition. Incorrect approaches analysis. One incorrect approach is to immediately attribute the symptoms solely to a known workplace hazard without a thorough investigation. This fails to consider other potential causes and may lead to misdiagnosis, inappropriate treatment, and a failure to identify other contributing factors to the worker's health. It bypasses the critical step of differential diagnosis, which is a cornerstone of medical practice and essential in occupational toxicology. Another incorrect approach is to dismiss the worker's symptoms as unrelated to work without adequate investigation, especially if the symptoms are vague or common. This can lead to a failure to recognize a genuine occupational illness, potentially resulting in delayed or absent treatment and continued exposure, which is a significant ethical and professional failing. It neglects the principle of do no harm by potentially leaving a worker exposed to a workplace hazard. A third incorrect approach is to rely solely on a single diagnostic test without considering the broader clinical picture and exposure history. Toxicological assessments are often complex and require integrating multiple pieces of information. Over-reliance on one test can lead to false positives or negatives, misinterpreting results in the absence of relevant context, and ultimately, an incorrect diagnosis and management plan. This contravenes the principle of comprehensive patient assessment. Professional reasoning. Professionals should approach such situations by first gathering all relevant information: the worker's detailed symptom history, a comprehensive occupational and environmental exposure history, and a complete medical history. This is followed by a thorough physical examination. Based on this initial assessment, a differential diagnosis should be formulated, considering both occupational and non-occupational causes. Appropriate investigation, including biological monitoring or environmental sampling if indicated, should be ordered to help confirm or refute suspected exposures. Management should be tailored to the confirmed or most likely diagnosis, with a focus on removing the worker from further exposure if an occupational cause is identified, and providing appropriate medical treatment. Regular follow-up is crucial to monitor the worker's progress and the effectiveness of interventions. This systematic, evidence-based approach ensures patient safety and upholds professional standards. Question 12. To address the challenge of a newly identified, potentially serious chemical exposure risk in a manufacturing plant, where the Joint Health and Safety Committee has raised concerns with management who appear hesitant to implement immediate, costly controls, what is the most appropriate course of action for the committee members under Canadian occupational health and safety legislation? Option A. Advise workers to take individual precautions and wait for management to decide on the best course of action, prioritizing cost-effectiveness over immediate risk mitigation. Option B. Immediately contact local media outlets to publicize the potential hazard and pressure management into action. Option C. Formally document the identified hazard and the employer's response, and if the employer does not take adequate measures, escalate the issue to the provincial or territorial Ministry of Labor. Option D. Focus on gathering more data and holding further informal discussions with management to avoid creating an adversarial relationship, delaying formal reporting. Correct answer is C. Formally document the identified hazard and the employer's response, and if the employer does not take adequate measures, escalate the issue to the provincial or territorial Ministry of Labor. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a company's desire to maintain a positive public image and the committee's statutory obligation to report safety concerns. The committee members are caught between their duty to their colleagues and the potential repercussions from management. Navigating this requires a strong understanding of their legal mandate and ethical responsibilities under Canadian occupational health and safety legislation. Correct approach analysis. The correct approach involves the committee members adhering strictly to their legal obligations as outlined in provincial/territorial occupational health and safety acts and regulations. This means documenting all identified hazards and concerns and formally reporting them to the employer. If the employer fails to address these concerns adequately, the committee has a further obligation to escalate the issue to the relevant provincial/territorial Ministry of Labor or equivalent regulatory body. This upholds the principle of worker safety as paramount and ensures compliance with the legislative framework designed to protect workers. The committee's role is to advocate for a safe workplace, and this includes the difficult but necessary step of formal reporting and escalation when informal channels fail. Incorrect approaches analysis. One incorrect approach is to dismiss the concerns to avoid conflict with management. This directly violates the committee's mandate under the Occupational Health and Safety Acts, which requires them to identify and report hazards. It also breaches their ethical duty to represent the workers and ensure their safety. This approach prioritizes expediency and personal comfort over legal and ethical obligations, potentially exposing workers to ongoing risks. Another incorrect approach is to only report the concerns informally to the supervisor without formal documentation or follow-up. While informal communication can be a useful first step, it is insufficient when dealing with potentially serious hazards. The Occupational Health and Safety Acts typically require formal reporting mechanisms and documentation to ensure accountability and provide a clear record of identified issues and employer responses. Relying solely on informal communication can lead to the concerns being overlooked or forgotten, and it leaves the committee without a record to demonstrate they fulfilled their duties. A third incorrect approach is to threaten to go to the media before exhausting all internal and regulatory reporting channels. While public awareness can sometimes be a catalyst for change, it is generally considered a last resort and can undermine the established regulatory process. The legislation provides specific avenues for reporting and enforcement, and bypassing these can be seen as unprofessional and may not achieve the desired outcome as effectively as following the prescribed procedures. It can also damage the committee's credibility and relationship with both management and regulatory bodies. Professional reasoning. Professionals in this situation must first consult the relevant provincial/territorial Occupational Health and Safety Act and regulations to understand their specific duties and powers. They should then document all identified hazards and the employer's responses meticulously. When informal discussions fail, they must follow the formal reporting procedures outlined in the legislation, escalating to the Ministry of Labor if necessary. Maintaining clear, objective communication and a focus on worker safety, grounded in legal requirements, is essential for effective decision-making. Question 13. Compliance review shows a worker presenting with recurrent respiratory symptoms, including wheezing and shortness of breath, which appear to be exacerbated during their shifts in a manufacturing facility. The worker handles various chemicals and raw materials. The occupational physician is tasked with evaluating the situation. Which of the following represents the most appropriate best practice approach for managing this worker's potential occupational sensitization? Option A. Initiate a course of bronchodilator therapy and advise the worker to manage their symptoms at home while continuing their regular work duties. Option B. Prescribe antihistamines and topical corticosteroids for symptom relief and recommend the worker avoid specific tasks they believe are causing their symptoms. Option C. Conduct a comprehensive occupational and environmental assessment of the workplace, identifying all potential chemical sensitizers, evaluating exposure levels, and collaborating with occupational hygiene professionals to implement targeted control measures. Option D. Advise the worker that their symptoms are likely due to a pre-existing non-occupational condition and recommend they seek treatment from their family physician. Correct answer is A. Initiate a course of bronchodilator therapy and advise the worker to manage their symptoms at home while continuing their regular work duties. Explanation. Scenario analysis. This scenario presents a common challenge in occupational medicine, managing a worker's suspected occupational allergy in a workplace where multiple potential sensitizers are present. The challenge lies in accurately identifying the causative agent, S, and implementing effective control measures while balancing the worker's health, workplace productivity, and legal obligations. The physician must navigate diagnostic uncertainty, the complexities of immunological responses, and the practicalities of workplace interventions. Correct approach analysis. The correct approach involves a comprehensive, multifaceted strategy that prioritizes worker health and adheres to the principles of occupational hygiene and medicine, as guided by Canadian regulatory frameworks. This includes a thorough occupational history, a detailed clinical assessment, and, crucially, a systematic investigation of the workplace environment. This investigation should involve identifying all potential allergens and sensitizers, assessing exposure levels, and evaluating existing control measures. Collaboration with occupational hygienists and safety professionals is paramount to ensure accurate environmental assessment and the development of evidence-based control strategies. The goal is to move beyond mere symptom management to addressing the root cause of the sensitization. This aligns with the ethical duty of care and the legal requirements under provincial/territorial occupational health and safety legislation to provide a safe working environment and manage workplace hazards. Incorrect approaches analysis. Focusing solely on symptomatic treatment without investigating the workplace environment is a significant regulatory and ethical failure. This approach neglects the fundamental principle of occupational medicine, identifying and controlling workplace hazards. It fails to address the underlying cause of the worker's condition, potentially leading to chronic illness, recurrent symptoms, and continued exposure, which contravenes the employer's duty to protect worker health. Attributing the symptoms to non-occupational causes without a thorough workplace investigation is also professionally unacceptable. While non-occupational factors can contribute to allergies, Dismissing potential occupational triggers without due diligence is a breach of the physician's responsibility to consider all relevant factors, particularly when a work-related exposure is plausible. This can lead to delayed diagnosis and inadequate interventions, potentially violating workers' compensation legislation and occupational health and safety standards. Implementing control measures based on assumptions rather than objective environmental assessment is another failure. Without proper identification and quantification of sensitizers, control measures may be ineffective, costly, or unnecessarily disruptive. This approach lacks the scientific rigor required by occupational health best practices and regulatory oversight, which mandate evidence-based hazard control. Professional reasoning. Professionals should approach suspected occupational allergies by first gathering a detailed history, including work tasks, materials handled, and environmental conditions. This should be followed by a thorough clinical examination. The critical next step is a systematic workplace assessment, ideally in collaboration with occupational hygiene experts, to identify and evaluate potential sensitizers and exposure pathways. Based on this comprehensive assessment, a diagnosis can be made, and a tailored management plan, including medical treatment and workplace controls, can be developed and implemented. Regular follow-up is essential to monitor the effectiveness of interventions and the worker's health status. This systematic, evidence-based approach ensures compliance with occupational health and safety legislation and upholds the highest ethical standards of patient care. Question 14. Stakeholder feedback indicates a recurring concern regarding the communication of medical information from occupational physicians to employers when an employee is experiencing a health condition impacting their work. Specifically, employers report difficulty in understanding an employee's functional capacity, and the necessary accommodations when the physician's report is overly focused on diagnostic details rather than work-related limitations. In this context, an employee has been experiencing recurrent episodes of severe migraines, impacting their ability to perform their duties as a data entry clerk, which requires sustained concentration. The employee has consented to the occupational physician sharing medical information with their employer, but has specifically requested that their diagnosis not be disclosed. Which of the following approaches best upholds the principles of occupational medicine and relevant Canadian regulatory frameworks in this situation? Option A. Provide the employer with a report detailing the employee's functional capacity, including specific limitations such as the need for frequent breaks, avoidance of prolonged screen time in poorly lit environments, and the potential for sudden incapacitation requiring immediate rest, without disclosing the specific diagnosis of migraines. Option B. Inform the employer that due to patient confidentiality, no medical information can be shared, and the employee is solely responsible for communicating their limitations and accommodation needs. Option C. Advise the employer that the employee is experiencing a serious medical condition that may permanently affect their ability to work, without providing any further details, and recommend immediate termination of employment to mitigate risk. Option D. Provide the employer with a detailed report outlining the employee's specific diagnosis, the underlying pathophysiology of their migraines, and the expected frequency and severity of future episodes, while noting the employee's consent for information sharing. The correct answer is D. Provide the employer with a detailed report outlining the employee's specific diagnosis, the underlying pathophysiology of their migraines, and the expected frequency and severity of future episodes, while noting the employee's consent for information sharing. Explanation. This scenario presents a professional challenge due to the inherent conflict between an employer's operational needs and an employee's right to privacy and appropriate medical management. The occupational physician must navigate these competing interests while adhering to the ethical and legal obligations governing medical practice in Canada, specifically within the context of occupational medicine, as defined by the Canadian Board of Occupational Medicine, CBOM, certification framework. The physician's primary duty is to the patient's health and well-being, balanced with the need to provide objective medical information to the employer to facilitate safe and appropriate work arrangements. The correct approach prioritizes the employee's medical confidentiality and focuses on providing functional capacity information relevant to work, rather than disclosing specific diagnoses or prognoses without explicit consent. This aligns with the ethical principles of occupational medicine, which emphasize patient autonomy and the physician's role as an independent medical advisor. In Canada, provincial/territorial privacy legislation, e.g., Personal Information Protection and Electronic Documents Act (PIPTA), or equivalent provincial acts, and professional college guidelines for physicians dictate the scope of information that can be shared with employers. The physician's responsibility is to assess the employee's ability to perform job duties, identify any work-related limitations or accommodations required, and communicate this information clearly and concisely to the employer, respecting the boundaries of medical confidentiality. This approach upholds the physician-patient relationship and ensures that employment decisions are based on objective medical assessments of functional capacity, not on potentially stigmatizing diagnostic information. An incorrect approach that involves disclosing the employee's specific diagnosis to the employer without explicit, informed consent represents a significant breach of medical confidentiality. This violates privacy legislation and professional ethical codes, potentially leading to discrimination and damage to the physician-patient relationship. Such disclosure undermines the trust essential for effective occupational health management. Another incorrect approach, which is to refuse to provide any information to the employer, even functional capacity, would be professionally problematic, as it fails to assist the employer in making necessary accommodations or ensuring workplace safety, thereby neglecting the physician's role in facilitating a healthy and productive work environment. This can also be seen as a failure to meet the employer's legitimate need for information to manage their workforce responsibly. A third incorrect approach, which is to provide a vague and unhelpful assessment that offers no actionable guidance for the employer, also fails to fulfill the physician's professional obligations. While respecting confidentiality, the physician must still provide sufficient information for the employer to make informed decisions regarding the employee's work status and necessary accommodations. The professional decision-making process for similar situations should involve a thorough assessment of the employee's medical condition and its impact on their work capacity. This includes obtaining informed consent for any information sharing with the employer. The physician must then determine what specific functional information is necessary for the employer to ensure workplace safety and facilitate appropriate accommodations. This information should be communicated clearly and concisely, focusing on capabilities and limitations rather than diagnoses. If there is ambiguity or resistance from either party, the physician should facilitate communication, potentially through a joint meeting with consent, or by clearly outlining the boundaries of medical information that can be shared. Adherence to provincial/territorial privacy laws and professional college guidelines is paramount throughout this process. Question 15. The control framework reveals a potential for increased musculoskeletal injuries in a manufacturing facility. The employer, in consultation with the Occupational Health and Safety Committee, is considering implementing a new program to mitigate this risk. Which of the following approaches best aligns with the rights and responsibilities of both employers and employees under Canadian occupational health and safety legislation and ethical occupational medicine practice? Option A. Rely solely on employees to report any discomfort or pain they experience and only address issues on a case-by-case basis after an injury has occurred. Option B. Implement a company-wide policy requiring all employees to wear specific supportive garments during all work hours, regardless of the specific tasks performed or individual ergonomic needs. Option C. Mandate that all employees undergo a preemptive physical fitness assessment to ensure they meet a certain standard before performing any task, without a specific job-related risk identified for each individual. Option D. Conduct a comprehensive job hazard analysis for all roles, involving employee input in identifying specific tasks contributing to risk, and collaboratively developing and implementing control measures, such as ergonomic adjustments and targeted training. The correct answer is D. Conduct a comprehensive job hazard analysis for all roles, involving employee input in identifying specific tasks contributing to risk, and collaboratively developing and implementing control measures such as ergonomic adjustments and targeted training. Explanation. This scenario is professionally challenging because it requires balancing the employer's duty to provide a safe workplace with the employee's right to privacy and autonomy, all within the specific legal and ethical framework of occupational medicine in Canada. A proactive risk assessment is crucial for identifying potential hazards and implementing appropriate controls before an incident occurs. The employer has a legal and ethical responsibility under provincial/territorial occupational health and safety legislation to assess and control workplace hazards, which includes identifying risks associated with employee health and safety. The employee, in turn, has a responsibility to cooperate with the employer in maintaining a safe workplace and to report hazards. The correct approach emphasizes a systematic, evidence-based risk assessment process that involves both employer and employee participation. This aligns with the principles of due diligence required by Canadian occupational health and safety legislation. By involving employees in the identification of risks and the development of control measures, the employer demonstrates a commitment to a collaborative safety culture, respects employee input, and ensures that assessments are practical and effective. This approach also respects employee privacy by focusing on job-related risks rather than personal health information, unless directly relevant to workplace safety and with appropriate consent. An incorrect approach would be to implement a blanket policy without a proper risk assessment. This could lead to overreach, infringing on employee privacy, and failing to address specific hazards effectively. For example, mandating specific health screenings without a clear link to identified workplace risks could be seen as discriminatory or an invasion of privacy, violating principles of fairness and respect for individual rights. Another incorrect approach would be to solely rely on employee self-reporting without independent verification or proactive assessment, which could miss critical hazards and fail to meet the employer's duty of care. This neglects the employer's proactive responsibility to ensure a safe environment. Professionals should approach such situations by first understanding the specific legislative requirements in their jurisdiction regarding occupational health and safety, including the employer's duty to assess and control risks, and the employee's rights and responsibilities. They should then follow a structured risk assessment methodology that includes hazard identification, risk analysis, risk evaluation, and the development of control measures. Crucially, this process should involve consultation with employees and their representatives, respecting privacy and focusing on job-specific risks. Documentation of the entire process is essential for demonstrating due diligence. Question 16. Consider a scenario where a novel chemical is introduced into a manufacturing process, and a review of current Canadian federal and provincial occupational exposure limits reveals no specific threshold limit, value TLV, or permissible exposure limit, PEL, for this substance. The occupational physician is tasked with assessing and managing the potential health risks associated with worker exposure. Which of the following approaches best reflects professional best practice in this situation? Option A. Rely solely on worker complaints and anecdotal reports to determine the level of risk and implement controls. Option B. Conduct a thorough review of available toxicological literature and guidance from authoritative international bodies to establish internal action levels and recommend appropriate control measures based on the best available scientific evidence. Option C. Assume that no significant health risk exists because there is no specific Canadian occupational exposure limit for the chemical. Option D. Wait for a specific Canadian occupational exposure limit to be established by a regulatory body before initiating any risk assessment or control measures. The correct answer is B. Conduct a thorough review of available toxicological literature and guidance from authoritative international bodies to establish internal action levels and recommend appropriate control measures based on the best available scientific evidence. Explanation. Scenario analysis. This scenario presents a common challenge in occupational medicine, managing potential health risks from chemical exposures in a workplace where specific exposure limits are not readily available or are outdated. The professional challenge lies in the absence of definitive regulatory benchmarks, requiring the occupational physician to exercise sound judgment based on available scientific literature, toxicological principles, and a proactive risk management approach. The responsibility extends beyond simply identifying hazards to implementing effective controls to protect worker health, even in the face of uncertainty. Correct approach analysis. The correct approach involves a comprehensive risk assessment that goes beyond simply checking for compliance with established occupational exposure limits (OL). It necessitates a thorough review of the available toxicological data for the specific chemical, considering its routes of exposure, potential health effects, acute and chronic, and dose-response relationships. This includes consulting peer-reviewed literature, reputable toxicological databases, and guidance from authoritative bodies like the American Conference of Governmental Industrial Hygienists, ECG, or National Health and Safety Agencies, even if specific Canadian OELs are absent. The focus should be on establishing internal action levels or guidance values based on the best available scientific evidence to inform control strategies. This proactive stance aligns with the ethical obligation to protect worker health and the principles of due diligence under Canadian occupational health and safety legislation, which requires employers to take all reasonable precautions to prevent workplace hazards. Incorrect approaches analysis, failing to conduct a thorough toxicological review, and relying solely on the absence of a specific Canadian OEL is a significant regulatory and ethical failure. It implies a reactive approach to risk management, waiting for a definitive regulatory limit before taking action, which is contrary to the precautionary principle. This approach neglects the employer's general duty to provide a safe and healthy workplace. Assuming no risk because no specific OEL exists is also a critical failure. Many chemicals have known health effects even without a formally established OEL. This approach demonstrates a lack of understanding of toxicological principles and a disregard for potential long-term health consequences. It can lead to significant underestimation of risk and inadequate control measures. Implementing controls based on anecdotal evidence or worker complaints alone, without a systematic risk assessment, is insufficient. While worker feedback is valuable, it should inform a more rigorous assessment rather than replace it. This approach lacks the scientific basis required for effective risk management and may not address all potential exposures or health effects. Professional reasoning. In situations lacking specific regulatory limits, occupational physicians must adopt a science-driven, proactive approach. The decision-making process should involve 1. Identifying the chemical and its potential uses/exposures. 2. Conducting a comprehensive literature search for toxicological data and any existing guidance values from reputable sources. 3. Evaluating the routes and potential levels of exposure. 4. Characterizing the potential health risks based on the available data. 5. Recommending and overseeing the implementation of appropriate control measures, e.g., engineering controls, administrative controls, personal protective equipment, to minimize exposure to the lowest feasible level, even if that level is below what might be considered a safe threshold due to data limitations. 6. Establishing a program for ongoing monitoring and re-evaluation as new information becomes available. Question 17. The investigation demonstrates a statistically significant increase in respiratory complaints among a cohort of workers in a manufacturing facility over the past 6 months. The occupational physician is tasked with determining the appropriate next steps for occupational health surveillance. Which of the following approaches best aligns with Canadian occupational health and safety regulations and best practices for occupational health surveillance? Option A. Initiate a comprehensive review of the facility's air quality monitoring data, worker exposure records, and medical surveillance history, alongside a targeted health questionnaire to assess specific symptoms and potential exposures, to identify any patterns or correlations. Option B. Immediately implement mandatory respiratory protection for all workers in the facility, regardless of specific exposure levels or confirmed causality. To preemptively address the perceived risk, Option C. Rely solely on individual worker reports of symptoms to guide any necessary interventions, without conducting broader environmental or medical data analysis. Option D. Advise management that the observed increase is likely due to seasonal variations in illness, and recommend no further action unless the trend continues for another year. The correct answer is A. Initiate a comprehensive review of the facility's air quality monitoring data, worker exposure records, and medical surveillance history, alongside a targeted health questionnaire to assess specific symptoms and potential exposures, to identify any patterns or correlations. Explanation. Scenario analysis. This scenario presents a common challenge in occupational health surveillance where a perceived increase in a specific health outcome among a defined worker group necessitates a thorough investigation. The challenge lies in differentiating between a true occupational health issue requiring intervention and a statistical anomaly or unrelated health trend. Professionals must exercise careful judgment to avoid overintervention based on insufficient evidence or, conversely, Under-intervention by dismissing a genuine occupational hazard. The complexity arises from the need to integrate epidemiological principles with practical workplace realities and regulatory compliance. Correct approach analysis. The correct approach involves a systematic, evidence-based investigation that adheres to the principles of occupational health surveillance as outlined by relevant Canadian regulatory frameworks and guidelines. This includes a comprehensive review of existing health data, a detailed assessment of potential workplace exposures, and the implementation of targeted surveillance measures if warranted. This approach is best professional practice because it prioritizes worker health and safety by ensuring that interventions are data-driven and proportionate to the identified risk. It aligns with the ethical obligation to protect workers and the regulatory requirement to identify and control occupational hazards. Specifically, it reflects the proactive and systematic nature of occupational health surveillance, mandated by provincial and federal occupational health and safety legislation in Canada, which emphasizes the employer's responsibility to provide a safe and healthy workplace, and the occupational physician's role in monitoring and advising on health risks. Incorrect approaches analysis. One incorrect approach would be to immediately implement broad, costly, and potentially disruptive control measures without a thorough investigation. This fails to meet the regulatory requirement for evidence-based risk assessment and management. It can lead to unnecessary expenditure, worker anxiety, and a lack of focus on the actual root cause if one exists. Ethically, it is inefficient and potentially harmful by diverting resources from more pressing issues. Another incorrect approach would be to dismiss the observed increase as a random fluctuation, without any further investigation. This is a significant regulatory and ethical failure. Provincial and federal occupational health and safety acts mandate employers and their designated health professionals to investigate potential hazards and adverse health outcomes. Ignoring a potential trend, even if initially uncertain, violates the duty of care and the principles of proactive occupational health surveillance, potentially leaving workers exposed to an unrecognized hazard. A third incorrect approach might involve relying solely on anecdotal reports from workers without systematically collecting and analyzing objective data. While worker reports are valuable triggers for investigation, they are not sufficient on their own to confirm an occupational health issue. This approach lacks the rigor required by occupational health surveillance standards and regulatory bodies, which emphasize objective data collection and analysis to establish causality and inform appropriate interventions. Professional reasoning. Professionals should approach such situations by first acknowledging the signal, the observed increase, and then initiating a structured investigation. This involves 1. Data review, critically examining the nature, timing, and characteristics of the reported health outcomes. 2. Exposure assessment, evaluating potential workplace exposures that could be linked to these outcomes. 3. Risk assessment, determining the likelihood and severity of harm based on the collected data and exposure information. 4. Surveillance enhancement, if a potential link is identified, implementing or refining targeted surveillance measures to gather more definitive data. 5. Intervention, developing and implementing evidence-based control measures if a causal or contributory occupational factor is confirmed. This systematic process ensures that decisions are grounded in evidence, aligned with regulatory obligations, and ethically sound, prioritizing the health and safety of the workforce. Question 18. Upon reviewing a 45-year-old administrative assistant who reports sudden onset of severe lower back pain after lifting a box of files, the employer is requesting an immediate assessment of the employee's ability to return to their regular duties, which involve prolonged sitting and occasional lifting of up to 10 kg. The employee states they are in significant pain and can barely move. What is the most appropriate course of action for the occupational physician? Option A. Inform the employer that the employee's subjective report of pain is the primary determinant and that the physician cannot provide a definitive assessment without the employee's full recovery. Option B. Advise the employer that the employee is likely unable to perform their duties and recommend they stay off work indefinitely until they report no pain. Option C. Rely solely on the employer's description of the job duties and the employee's statement of pain to determine if they can return to work immediately. Option D. Conduct a thorough physical examination to assess range of motion, neurological function, and pain provocation, and then provide a clear, evidence-based assessment of the employee's functional capacity for their specific job duties, including any necessary work modifications or restrictions. The correct answer is D. Conduct a thorough physical examination to assess range of motion, neurological function, and pain provocation, and then provide a clear, evidence-based assessment of the employee's functional capacity for their specific job duties, including any necessary work modifications or restrictions. Explanation. This scenario presents a common challenge in occupational medicine, balancing the immediate needs of an employee experiencing acute musculoskeletal pain with the employer's need for a timely return to work and the physician's ethical and regulatory obligations. The physician must consider the employee's well-being, the potential for exacerbation of the injury, and the employer's operational requirements, all within the framework of Canadian occupational health and safety legislation and professional medical standards. The correct approach prioritizes a thorough, objective assessment of the employee's condition, considering both subjective reports of pain and objective physical findings. It involves a clear, evidence-based determination of work capacity, focusing on functional limitations rather than a simple fit for duty or not fit for duty dichotomy. This approach aligns with the principles of evidence-based medicine and the ethical duty to provide competent care, ensuring that any work recommendations are safe and do not compromise the employee's health. It also respects the employer's right to understand the employee's functional capacity to make informed decisions about work accommodations. An incorrect approach that focuses solely on the employer's desire for an immediate return to work without adequate medical assessment risks exacerbating the injury, leading to prolonged absence, increased healthcare costs, and potential legal repercussions for both the physician and the employer. This fails to uphold the physician's primary duty of care to the patient. Another incorrect approach, which involves providing a vague or noncommittal assessment, leaves the employer without the necessary information to manage the employee's return to work safely and effectively, potentially leading to further injury or an unsafe work environment. This also fails to meet the professional standard of providing clear, actionable medical advice. A third incorrect approach, which involves deferring the entire decision-making process to the employer without providing a medical opinion on capacity, abdicates the physician's professional responsibility and could lead to inappropriate work assignments that harm the employee. Professionals should approach such situations by first conducting a comprehensive history and physical examination. They should then objectively assess the employee's functional capacity for specific job tasks, considering any limitations due to the injury. This assessment should be communicated clearly and concisely to both the employee and the employer, outlining recommended work modifications or restrictions. The decision-making process should be guided by the principle of least restrictive alternative that still allows for safe and productive work, while always prioritizing the employee's health and safety. Collaboration with the employer to explore potential accommodations is crucial, but the medical opinion on capacity remains the physician's responsibility. Question 19. Benchmark analysis indicates that a 45-year-old warehouse worker who sustained a lumbar strain from improper manual lifting techniques 2 weeks ago reports feeling much better and ready to go back to work. The employee's physician has provided a note stating the employee is recovering well. The worker's primary duties involve lifting boxes weighing up to 25 kg from floor level to waist height, often in repetitive sequences. Considering the principles of occupational health and safety in Canada, what is the most appropriate next step for the occupational physician to ensure a safe and sustainable return to work? Option A. Advise the employer to assign the worker to light administrative tasks indefinitely, without a specific assessment of their ability to return to their core manual handling responsibilities. Option B. Recommend a functional capacity evaluation that specifically simulates the worker's typical manual handling tasks, including lifting, carrying, and repetitive motions, to objectively assess their readiness for full duty. Option C. Rely solely on the treating physician's note, assuming the employee's subjective report of improvement is sufficient to resume all manual handling tasks without further assessment. Option D. Accept the employee's self-report of feeling much better and clear them for immediate return to all previous duties, as indicated by the treating physician's general recovery note. Correct answer is B. Recommend a functional capacity evaluation that specifically simulates the worker's typical manual handling tasks, including lifting, carrying, and repetitive motions, to objectively assess their readiness for full duty. Explanation. This scenario presents a common challenge in occupational medicine, balancing the immediate need for an employee to return to work with the long-term goal of preventing re-injury and ensuring compliance with occupational health and safety principles. The physician must consider not only the employee's subjective report of recovery, but also objective functional capacity and the specific demands of the job. The challenge lies in making a decision that supports the employee's well-being and employability, while adhering to the employer's obligations under Canadian occupational health and safety legislation, which emphasizes the prevention of workplace hazards, including those related to manual handling. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment of the employee's readiness for return to work. This involves a functional capacity evaluation that directly simulates the physical demands of the job, particularly those involving manual handling. This aligns with the principles of the Canada Labour Code and provincial/territorial occupational health and safety acts, which mandate employers to provide a safe working environment and employees to work safely. A functional assessment ensures that the employee can perform the required tasks without undue risk of re-injury, thereby protecting both the employee and the employer from further harm and potential liability. It also supports a structured and safe return-to-work program, which is a key component of effective occupational health management. An incorrect approach that relies solely on the employee's self-report of pain reduction fails to adequately assess functional capacity. This is a regulatory failure as it bypasses the employer's duty to ensure the employee can safely perform their duties, potentially leading to a breach of the duty of care under relevant legislation. Ethically, it risks re-injury and prolonged absence. Another incorrect approach that involves immediately clearing the employee for all duties without any functional assessment is also a significant regulatory and ethical failure. This demonstrates a disregard for the specific risks associated with manual handling tasks and the potential for exacerbating the injury. It places the employee at undue risk and fails to uphold the employer's responsibility to manage workplace hazards. A third incorrect approach that involves assigning modified duties without a clear understanding of the employee's current functional limitations and the specific requirements of the original role is also problematic. While modified duties can be beneficial, they must be based on a thorough assessment and clearly defined to be effective and safe. Without this, it can lead to confusion, potential overexertion in modified tasks, or a failure to address the root cause of the manual handling risk. The professional decision-making process for similar situations should involve a systematic approach. 1. Gather comprehensive information. Obtain the employee's medical history, the nature of the injury, treatment received, and the employee's subjective report of recovery. 2. Understand job demands. Obtain a detailed job description, specifically noting the manual handling tasks, weights, postures, and frequencies involved. 3. Conduct a functional capacity evaluation, FCE. This is crucial for assessing the employee's ability to perform specific job tasks safely. The FCE should simulate the manual handling requirements of the role. 4. Collaborate with the employee and employer. Discuss findings and recommendations with the employee and their supervisor or HR department. 5. Develop a return-to-work plan. This may include a phased return, modified duties, or full return, all based on the FCE results and job demands. 6. Document thoroughly. Maintain detailed records of all assessments, recommendations, and plans. Question 20. Examination of the data shows that an occupational physician is consulted regarding an employee experiencing symptoms that may be work-related. Which of the following best defines the scope of occupational medicine in this context, according to Canadian regulatory frameworks and professional guidelines? Option A. The provision of medical advice to employees regarding general health and well-being, irrespective of any connection to their work environment. Option B. The assessment and management of employee health issues primarily to determine fitness for duty and to minimize employer liability. Option C. The exclusive medical treatment of diagnosed occupational injuries and illnesses, focusing solely on the clinical management of the employee's condition. Option D. The comprehensive practice focused on the prevention of occupational injury and illness, promotion of worker health and safety, and the assessment and management of health conditions arising from or affecting work, including hazard identification, health surveillance, and return-to-work planning. The correct answer is D. The comprehensive practice focused on the prevention of occupational injury and illness, promotion of worker health and safety, and the assessment and management of health conditions arising from or affecting work, including hazard identification, health surveillance, and return-to-work planning. Explanation: this scenario presents a professional challenge due to the inherent complexity of defining and delineating the scope of occupational medicine within the Canadian regulatory landscape. Professionals must navigate the interplay between medical expertise, employer responsibilities, employee rights, and provincial/territorial legislation governing workplace health and safety. Careful judgment is required to ensure that the practice of occupational medicine aligns with established ethical principles and legal mandates, particularly concerning the prevention of occupational disease and injury and the promotion of worker well-being. The correct approach represents best professional practice because it accurately reflects the broad mandate of occupational medicine as defined by its core principles and regulatory expectations in Canada. It emphasizes the proactive and preventive aspects, encompassing not only the diagnosis and treatment of work-related illnesses, but also the assessment of workplace hazards, the development of health surveillance programs, and the provision of advice on workplace accommodations and return-to-work strategies. This holistic view is crucial for fulfilling the ethical obligation to protect and promote the health of workers, as supported by the general principles of occupational medicine practice and relevant provincial/territorial occupational health and safety acts. An incorrect approach that narrowly defines occupational medicine solely as the treatment of diagnosed work-related injuries fails to acknowledge the significant preventive and consultative roles inherent in the discipline. This oversight represents a regulatory and ethical failure by neglecting the broader scope of hazard identification, risk assessment, and the implementation of control measures, which are fundamental to preventing occupational diseases and injuries in the first place. Such a limited perspective would contravene the spirit and intent of occupational health and safety legislation, which mandates employers and their agents to create and maintain a safe working environment. Another incorrect approach that focuses exclusively on the medical management of employees without considering the workplace environment or employer responsibilities is also professionally unacceptable. This approach ignores the core tenet of occupational medicine, the relationship between work and health. Ethically, it fails to address the root causes of health issues that may stem from workplace exposures or conditions. Legally, it bypasses the employer's duty to provide a safe workplace and the occupational physician's role in advising on workplace modifications or accommodations, thereby potentially exposing both the employee and employer to further risks and non-compliance with relevant legislation. The professional reasoning process for similar situations should involve a thorough understanding of the definition and scope of occupational medicine as it applies within the Canadian context. This includes consulting relevant professional guidelines, legislation, such as provincial/territorial occupational health and safety acts, and ethical codes. Professionals should always consider the tripartite relationship between the worker, the employer, and the occupational physician, ensuring that their actions are aimed at promoting worker health and safety while respecting the rights and responsibilities of all parties. A comprehensive assessment of the work environment, potential hazards, and the employee's health status is essential for effective occupational medicine practice.